Our aim as an organisation is to be a truly inclusive employer and one which recognises, respects, values and harnesses the diversity of our workforce.
We've learnt from the workforce race equality standard that our BME staff have a disproportionate employee experience compared to white staff.
There were some BME doctors who thought they were being treated differently, and we needed to identify what the problem was.
We have similar statistics for our LGBT staff and our disabled staff.
If they came into our hospital services, they may feel that they would be discriminated against.
Nobody should feel treated differently on the basis of colour.
It's really important that we treat all patients with dignity and respect and as individuals. I also think that it's important to behave towards each other in a very inclusive way and accepting difference.
Understanding employee experience for members of staff from different groups is really important.
It's absolutely essential, because what we cannot do at all is become complacent and assume that we're getting it right.
We are part of the solution, and we have to contribute towards the generation of that solution.
A group of patients told us that they had particular difficulties accessing our services because of a particular protected characteristic.
Sharing their experiences has allowed us to make relatively simple changes that make a fundamental difference to the services that they receive.
The positivity that they gave back to us was it was heartwarming.
And if we don't ask people how they feel about when they access our services, we don't know whether we're doing a good job, a poor job, an excellent job.
In everything that we do, we review the impact of that on different groups, so we're continually improving, both from an employee and a patient perspective.
In the end, this is all to patient benefit.
The evidence is really strong that having a diverse workforce results in better patient care and higher employee satisfaction.
Setting up staff networks for people from protected groups.
Start engaging with those groups to actually make them feel more comfortable about declaring that they've got particular individual needs.
Staff have a wealth of knowledge and experience.
We've got groups in the organisation giving us feedback, helping us to develop policies and procedures.
I'm particularly pleased with the partnership and the work that we're doing with the help of BAPIO.
The fixing of this problem has to be done in partnership, and that is why we approached the organisation and have had phenomenal success.
To help us understand how we best support our BME staff across the Trust.
The Trust Board absolutely have inclusion and diversity at the forefront of their agenda.
People that are using our services and staff that want to come and work at University Hospitals of Morecambe Bay.
I want to ensure that their working experience is as positive as anyone else's.